thank my colleagues in Denmark and in France for organizing this wonderful international conference. And obviously, we in Italy couldn't stay away from this discussion, as Italy was the first country to be hit by the epidemics and one of the worst hit worldwide. The situation now is far from being ideal. We're still averaging at 12,000 new cases every day, and from roughly 300 to 500 COVID-related deaths daily. Italy has been suffering one of the highest fatality rates on the continent, if not the highest. And although the country is trying to reopen now, it is still a very slow, and I would even say a painful process. Many travel restrictions remain in place. People are still obliged to wear masks indoors and outdoors. There's a national 10 p.m. curfew, limits on public transport and other social distancing norms aimed at preventing the health system from collapsing. But I would probably stop here and pass the word to our specialist in Italy, who would be able to tell you much more on the subject. And just briefly, I would like to present our guest today, Dr. Andrea Silenzi, who has a PhD in public health and biomedical sciences from the Università Cattolica del Sacro Cuore in Rome, and is a specialist in hygiene and preventive medicine since 2015. The Russian Center for Science and Culture has been happy. It's been a long friendship. We know each other from 2014, as Dr. Silenzi was one of the first members of our program, New Generation, which sees professionals, young professionals internationally travel to Russia and expand their professional experiences. Ever since, Dr. Silenzi has been growing professionally, and right now he is, among other activities, obviously, he is public health consultant for the Italian National Institute of Health. Dr. Silenzi, grazie per essere qua.
Thank you very much, Dr. Puskova. It's a pleasure to be here. Thank you for having me in this important meeting. I prepare some slides, and with this presentation, I would like to share with you some snapshots of the current situation in Italy in order to present the strategy we use during the second wave of the COVID-19 pandemic, with the aim to prevent severe health outcomes and to preserve the economy as much as possible. This is the structure of our healthcare system. Our NHS, as Dr. Puskova said, has been extremely impacted by the pandemic. As you know, some of territories of Lombardy region has been the first part of the Western world interested by the spread of the virus in February and March 2020. The Italian healthcare system is based on a public and tax-based NHS, National Health Service, is divided into 21 different regional health services that in an ordinary situation are completely autonomous in terms of management and organization of healthcare. Normally, in fact, the Ministry of Health is in charge of the national planning and monitoring of the respect of the essential levels of care provided by every single region. Since January 31st in Italy of 2020, in Italy is enforced a national scientific board supporting the decision of the Ministry of Health and the whole government. And the Civil Protection Department of the Presidency of the Council is in charge of the coordination of some activities, both at national and local level, supporting the regional NHS. This is the situation right now that we are facing in our country. We had more than 2,600,000 confirmed cases. The real numbers probably account for more than 10 million according to the estimates based on zero surveys, and we have roughly 90,000 deaths at the moment. So we are extremely impacted by the pandemic. And it's really interesting to say, I come back to this slide, because as I said, the first wave of the pandemic was quite concentrated in a part of northern Italy. So that's why also our case fatality rate is different from the other countries which we can compare in Europe, at least, because in March of 2020, Lombardy, Veneto, and Emilia-Romagna were facing I can say, not very well prepared this pandemic. And after a strong national lockdown, ended in June, we had a sort of summer break, and now from the end of August, we enter in the second wave that right now, as you can say, is in a really, I mean, medium situation, not so bad like the Northern European countries, but we are really, I mean, concerned about the situation. More than numbers alone, it's quite important to go deeper on data. So I would like to present you some data from the weekly report of our National Institute of Health. And it's important to analyze the demographic and epidemiological situation in Italy. In the first figure on the upper left side, you can see the proportion of total cases notified in Italy by age group since the beginning of the outbreak in February 2020. As you easily see, the majority of deaths are referred to elderly and old, also with chronic condition, but severe health outcomes also occurred in younger cohorts of people. In the second figure on the upper right side, we have the distribution of cases sorted by setting. After the first wave, during which Lombardy had to manage a lot of severe cases in the hospital setting, now with the increasing efficacy of the 3T strategy, so testing, tracing, and treating, we are more effective in isolating the cases and the contacts using quarantine measures. And as you can see in the figure on the lower left side, the majority of new cases are symptomatic or pauci-symptomatic at the moment. If we look at the figure on the lower right side, the median age of COVID-19 patients returned higher after a summer break, in which the most affected were the young and young adults with asymptomatic or pauci-symptomatic cases. Which were the intervention we used to flatten the curve during the first wave. If you look at this timeline on the upper left side, in this slide, as I said, we were the first Western country to use put in place a full lockdown in March of the 2020 after a first local measure of containment. And we tried to freeze the spread of the virus, and doing so we were able to preserve the central and the south part of Italy during the first wave. During the last month, we invest resources to strengthen the primary care setting, for example, hiring new doctors of the Department of Prevention for the contact tracing activities, and investing on general practitioners to clinically supervise the patients at home with the use of telemedicine in different situations, in particular for positive patients with chronic conditions. Now the main challenge we are facing is to face the situation of COVID in every region of Italy. As you can see in the map on the right of this slide, the situation now is completely different. All Italy is impacted by this virus, and the national strategy we are encouraging is basing on strengthening and rationalization of testing, the sequencing, also related to the situation of the variants, the virus variants, and to strengthen the contact tracing capacity in every region. For example, one of the activity was in October when the Ministry of Health approved the use of rapid antigenic tests, also both for screening diagnosis. Has been extremely important, this decision, to allow the screening in different contexts, for example, at work or during the activity at schools, during the schools and in primary care school. Moreover, this is particularly important, and also to speed up the release of asymptomatic contacts from the quarantine measures. Moreover, since January, we created a new consortium to put together all the capacity of sequencing in order to tackle the challenge of the new variants of concerns. For example, the so-called Kent or UK variants, the B117, or the South Africa and the Brazilian, the Manaus one. And the Istituto Superiore di Sanità, our National Institute of Health, is the national hub of a network of academic and regional research laboratory. At the moment, we are conducting a national service to define the prevalence of SARS-CoV-2 variants in Italy, and the first results are related to a prevalence of roughly 15% of the UK variants, according to the estimates also in France, in Switzerland, so in all the countries near the Italian boundaries. And as I said, the main player of this strategy against the pandemic in Italy is the Istituto Superiore di Sanità, the technical scientific body of the Italian NHS that provided several activities during the first and the second waves, data monitoring, risk assessment, response planning for outbreak, the preparation of different reports and interim guidelines in a strong relationship with the international institutions. And another important news can I add in this presentation is the situation related to vaccination campaign in Italy. At the moment, we inoculated more than 2,500,000 doses of vaccine. We are using the free vaccine allowed here in the European Union. We start our campaign the 27th of December 2020 in accordance with the COVID-19 vaccination days of the European Union. And at the moment, we covered roughly 4% of the population with one dose, and roughly 2% of the population with 2 doses, so with the complete cycle of immunization. Our plan is based on 4 different phases. At the moment, we cover all the public health staff, elderly in nursing homes, and we are starting with people that live at home with family over 80 years old, and other vulnerable and people characterized by frailty. We are using, as I said, the free vaccine authorized in Europe by the European Medicine Agency, but the quantity are not enough for the standard of the campaign, and we hope to have as soon as more vaccines also coming from other industry and other countries to enlarge the possibility to access the vaccine to all the population at the soonest. That's why I personally hope that also the Gamaleya vaccines, the Sputnik, will be evaluated by the European Medicine Agency at the soonest, because I saw, as the colleagues previously said, that the last article on Lancet, the results were very, very good, and it's a vaccine that is extremely important also in the use of the primary care setting. That's the data in comparison of the other countries, but I think that you are aware of the situation. So the point is that we are ready for the vaccination, but we need more vaccines. So that was an attempt to synthesize the situation here in Italy, and thank you again for your invitation.